Aid organisations are calling for more international pressure for a ceasefire in Gaza. This comes as new data shows the scale of aid obstruction from Israel's siege. Country Director of ActionAid Palestine, Jamil Sawalmeh, joined Bridget earlier.
Now, can you explain to us, because we've been hearing this for many months, that in fact the aid is there. It's there often at the crossing or at the border. But what happens to it? Why doesn't it get to the people that need it when it's actually ready to go on the trucks? Can you explain that to our audience?
Yes, of course. So just to give you some background to this. So before October 2023, Gaza was in need of 500 trucks in terms of goods and materials transported into Gaza on a daily basis. And that was barely enough to meet the basic humanitarian needs in Gaza. So as in light of the current crisis in Gaza, we've been seeing that only 69 trucks have been able to enter Gaza on a daily basis in August, which is shocking. That what you referred to in the beginning, which is 83% of the needed aid now to respond to the basic needs of the population in Gaza. And the reasons that we are actually seeing now is the fact that it is very much obstructed by access mechanisms. Since Israel is controlling the only border crossing into Gaza now, which is Kerem Shalom crossing, after the closure of Rafah crossing at the Egyptian borders since May this year, aid has been severely obstructed. As you said, so we have a lot of aid that is piled up at the Egyptian side of the borders, but also there's a lot of aid that is currently piling up at Kerem Shalom crossing, which is not being processed because of systematic obstruction of aid, and aid is being used also as a weapon of war in Gaza. International organizations and UN member states have been calling to facilitate aid entry into Gaza, because we're seeing that in comparison to the dire need, there is also availability of aid outside the borders of Gaza waiting to be cleared by Israel. And that has been obstructed by, several policies that Israel has put in place. One of them is using, famine as a weapon of war. Other reasons that are related to bureaucracy and also delays and denials of certain materials and certain items, especially when we're speaking about oxygen cylinders and desalination plants that are necessary to meet the basic needs of the people. But also there are also other reasons related to destruction of infrastructure inside Gaza, which makes it extremely difficult to transport aid. In addition also to the security situation, which also imposes additional safety and security threats for the staff of international organizations, including ActionAid and local partners who are trying to access the crossings on almost daily basis, but the security situation is not always safe for them to approach that area, since they have to go through active combat zones. And therefore, obstruction has been one of the most challenging situations that we are facing as international agencies and local partners working in Gaza. And also, just to finish on that point, also distribution inside Gaza is becoming more and more difficult due to the targeting of aid convoys. We have seen about a week ago, or 10 days ago, one of the American international organizations that have actually coordinated one of the aid convoys. And despite the fact that it was coordinated with the Israeli forces, yet the convoy was attacked and 5 Palestinians were killed as a result of that attack on aid convoy. Additionally, also the UN have stated in their data that only 2 missions to the northern part of Gaza have been cleared out of 26 missions that were actually submitted to the Israeli army, which also gives you a picture of how difficult and challenging operations inside Gaza are. Despite that, that fact, we are still, as international organizations, dealing with the situation on a daily basis, trying to do our best with our local partners and our local staff based in Gaza to be able to serve the people who are most in need inside Gaza.
Well, given you've said that this has become an intolerable situation, that aid is being politicised and used as a weapon of war, Jamil, what would be your message to the government here in Australia about the role it can play in ensuring that Palestinians are not going hungry?
Yes, of course. We definitely value all of the humanitarian aid and support provided by the Australian government. Yet we are calling for the Australian government to use its diplomatic pressure, use the diplomatic channels that they have with Israel, with the international community, to also call and join forces calling for a permanent and ceasefire, because that's the only solution that could, respond or allow us to respond to the humanitarian needs in Gaza. And definitely the Australian government have a role to play there, and also to call for, the application of international law, and definitely, being actively engaged at the UN level with all the efforts that all the international community are calling now for a permanent and ceasefire. That's the only thing that would allow us to respond to the needs of the Gazan population.
It's important that that message gets through. Jamil Sawalmeh, thank you very much for your time on News Breakfast this morning, and well done on the amazing work you're doing with your partner organisations.
Thank you very much, Bridget. It was a pleasure talking to you.
I might just highlight a couple of other points that Jamil had raised with us, which is that it's not just food but medical supplies, Michael, that are in desperate need in Gaza. So insulin supply, blood supply, well done, hygiene items, items for babies and pregnant women, all in drastic short supply.
Yeah, and that was underscored by Mustafa Mohammed, the Australian doctor we spoke to from Perth, who worked over in Gaza for a period. One of the hospitals he was working at had one thermometer. So